Chris Garcia Wild. I'm an internal medicine and pediatrics resident doctor at Mount Sinai, and I also work at Settlement Health, one of the clinics in East Harlem. I'm excited to talk to you all today about when to go to the hospital. And today's conversation will really be focused on respiratory symptoms. So, the common cold, asthma, things like that are more common in the winter. The beginning of the presentation will be for children, mainly pediatrics, and then the second half will be about adults. The first things that you may notice when you have a child in your life who's sick this winter are the common cold symptoms: congestion, sore throat, a cough, maybe a slight fever. Those things are usually okay to manage at home. You probably have experience with this, giving them fluids and maybe some Tylenol for discomfort. As long as they are tolerating food for the most part and hydrating well, then they can usually be managed at home. If your child or the child in your life continues to pee and urinate at least 3 times a day, then usually that's a good sign that they're well hydrated and you can stay at home to manage the cold. Just keep a close eye on them and make sure that they're not stopping to urinate, or else that could be a sign that they're dehydrated. Another thing that we like to look for in children when they have respiratory symptoms is to make sure that they're still awake and interactive during the daytime. They may be more tired than usual, maybe aren't running around and as playful, but as long as they're engaging with you and alert and responding to you when you speak to them, then those are good signs. If they're laying down and not really waking up, then that's more when you should be concerned and go to the emergency room. Some folks have pulse oximeters. If you do have one, I highly recommend you read the instructions that come with it and bring it to your doctor's office to discuss how to use it if you haven't already learned. In children, usually the ideal number for the oxygen level on the pulse oximeter is 94 or higher. And if it says that while your kid is at home sick, then you can feel reassured that usually you'll be able to handle this at home. Now, some signs and red flag symptoms that really should make you concerned and encourage you to go to the emergency room this winter. If the child starts to have very fast breathing, or they're flaring their nose, opening their nostrils really wide to try to pull in air, then those are signs that they're struggling to breathe and should probably go to the emergency room so they can get evaluated and maybe get some treatment. Sometimes little kids will have signs of respiratory distress by pulling in the skin between their ribs or even in their neck above their sternum below their breathing pipe. You'll see the skin tugging in. And those are usually signs that they're really working hard to breathe, that they're struggling to pull the air into their lungs. So if you see that, then you should definitely go to the emergency room and also call your pediatrician. If at any point the child starts to change colors and becomes blue, especially around the lips and the face, or if they look extremely pale and it's not their baseline, then you should also go to the emergency room. Usually if the child is turning blue, it's a sign they may not be getting enough oxygen. And just how we spoke just now about lethargy and energy, if the child is not really engaging, not responding to you, and just seems to be way knocked out, then you should definitely go to the emergency room to get them evaluated because they may be very sick. Another tool that we use in our children who are old enough to speak a sentence, so usually they'll be a few years old or even adolescents, elementary and middle school age kids should be able to speak a sentence. But if they're coughing so much or struggling to breathe so much that they can't breathe or they can't speak a full sentence because they have to stop to breathe or because they keep coughing persistently, then that's a sign that you should go to the emergency room as well. A few other signs are when they're so dehydrated that they're crying, but they're not making any tears. If their eyes look dry while they're crying, or if their mouth looks very dry, or if they're not peeing 3 times a day. If they stop peeing at all completely for a 12-hour period, or if they're not peeing at least 2 to 3 times a day, then you should take them to get evaluated because that's a sign of dehydration. And finally, pulse oximeter reading is less than 90, then you should get an evaluation, go to the emergency room. If it's in the low 90s and you have some experience with this and your child has a known history of asthma and you have a detailed plan for what to do in that case called an asthma action plan, then you should follow the plan that you've already reviewed with your provider. This is only when kids have a known diagnosis of asthma and the doctor has already written out instructions for what to do at home in the event of having shortness of breath or wheezing symptoms. Otherwise, if the oxygen is low and you don't have a plan like that, then you should just go to the emergency room to get evaluated. So these are some of the red flag signs. A lot of this is not easy to identify unless you've seen it before. So we're gonna take a look at some visuals in a second so that you'll retain what these look like. So when you see them in real life, you'll be able to identify them. Just before we go into the visuals, I just wanna flag for you that any child under 2 months of age who has a fever has to go directly to the emergency department. And that's even if they don't have any other symptoms. They don't need to have a cough or any respiratory symptoms. In this age group, the first 2 months of life, we are very worried about a severe infection of the brain and spinal cord called meningitis. So if they're febrile and they're less than 60 days old, you have to go directly to the emergency room for evaluation. If they're older than 60 days old, then you can call your pediatrician or also go to the emergency room if you can't get through to the doctor. So now we're gonna just take a quick look at some visuals of respiratory distress in pediatrics. So if you see any of these things at home, then you should go to the emergency department. So here you can see the skin pulling in here as well, some fast breathing. More skin tugging. You can see the skin tugging in the neck and very fast breathing here. Same thing. You can also see the nose is kind of broad, widely spread open to pull air in. This kid is working so hard to breathe, their head is bobbing back and forth. So those are just some of the signs that you may see, and that's what we'll look for when the child arrives to the emergency department or if you take the kid to the pediatrics office. These are some pictures of what that may look like. On the left are the skin tugging. In the middle is the blue skin discoloration when they're not getting enough oxygen. This is most visible in young children. And then on the right is nasal flaring when they're really opening their nostrils really wide to try to pull in air. Those are all signs that they're struggling to breathe and that you should head to the emergency room. Just a few comments on a pulse oximeter in case you have one at home. A pulse oximeter, a lot of these devices became common during COVID. They're basically a device that measures the oxygen level in your blood. You put the little device on your finger all the way to the end of your finger as deep as it can get, and then you're supposed to rest. Usually you do not interpret the numbers on the screen for at least 5 minutes of resting, because if you're walking around and moving, then it may give you a false reading. And you have to make sure your finger is clear and clean without anything else on it, no Band-Aid. If you have artificial nails or nail polish, it can also cause a false reading. Once you've kept it on steadily for a while, then you want to interpret the number where it says SpO2, oxygen saturation, and that's the number that will tell you the oxygen levels. The other number is your heart rate. That's not really as related to the oxygen levels, but it can tell you how hard your heart is working. For children, usually we want an oxygen level of 94% and up, and then for adults, 90% and up, unless you have a condition, a COPD, or something you've discussed with your doctor. Adults with COPD can have oxygen levels of 88% and up at rest, and usually can stay at home and not have to get further evaluation if this is their baseline. If you have a major change in your oxygen level and it shows to be consistent despite waiting around and repeating it, then you should still get evaluated by a doctor. Brief drops in this number are normal, especially if you get up to walk to another room and come back for a few minutes. But if the oxygen level remains low and at the same time the child or the adult is having respiratory symptoms, then together these signs are alarming. By itself, we don't really rely on the number, but if there's symptoms with an abnormal number, then we do get alarmed and you should get evaluated by a doctor. Make sure you read your instructions with your device if you have one, because they're different for each device. Now, a few comments on adults and when to go to the hospital for respiratory symptoms. They're very similar to children. The main difference is that you may not be able to see the signs of skin tugging as often in adults because we're larger people, but you will still be able to see that your loved one is breathing too quickly. Sometimes they'll get confused. They may not remember conversations earlier that day or what day of the week it is. If this is off of their baseline, then this confusion could be a sign of severe sickness and you should go to the hospital. Adults also can flare their nostrils and open them really widely. That's a sign that they're not getting enough air and they need to be evaluated. And if they're also unable to speak a sentence, that was actually a really important tool during the beginning of the COVID pandemic, where doctors would do do telehealth visits. And if patients were unable to speak for long enough to speak a sentence, then we were really alarmed and would usually send an ambulance to their house. If your pulse oximeter for an adult is less than 90%, then definitely we'll have to get evaluated, especially if this is new and they don't have COPD. And then if at any point you develop chest pain or palpitations, if you feel like your heart is racing, or if you have any kind of crushing chest pain that makes you think of a heart attack, then you'll have to go to the hospital as well. Finally, if you're fainting or dizzy, these may be signs that you're dehydrated from your infection or your symptoms, and you'll have to get evaluated to make sure you don't need any intravenous hydration. And lastly, just a general tip is that if at any point an adult develops slurred speech, numbness, or weakness, especially on one half of their body or any of their legs or arms, then you should get evaluated by a doctor. And a lot of times this is not related to a cold or respiratory symptoms, and this may be a stroke, but sometimes multiple things can happen at once. So I just wanted to plug that as a general health tip, that if any adult develops slurred speech or numbness or weakness, then you should call an ambulance to come pick you up. Some visuals for adults. On the left side, you'll see a gentleman, and some of the signs of respiratory distress are labeled. So here you can see intercostal tugging. That just means the skin is pulling between the ribs. But as you can see, this gentleman is very thin. And if the person is not very thin, it may be hard to appreciate that. You can also see underneath the breathing pipe, the trachea, some tugging here like we saw in the children, and some flaring of the nostrils, and also very wide eyes. A lot of times when people are having difficulty breathing, they'll open their eyes very widely as a sign of distress. And then here on the right is an example of the pulse oximeter. This number, 88% below SpO2, is the oxygen level. And if this person does not have COPD and they're usually in the high 90s, then this may be a concerning sign and they should go to the emergency room or at least call their doctor. So those are most of my tips for when to go to the emergency room for respiratory symptoms in children and adults. In general, I want you all to consider if there are any red flags at all, any of those signs of respiratory distress on their body, or if they're unable to speak for too long, then definitely just call 911 or go to the emergency department. It's better to be safe than sorry, and we are always happy to evaluate you, whether it's at the clinic or in the hospital. And it's better to just be safe and know that you are seen by a provider than to stay at home and worry. If you have milder symptoms, you can always call your doctor, whether it's a pediatrician or a general primary care doctor, and ask for an urgent visit. Some doctors will also have telehealth visits, and they can actually see you virtually to try to see how bad your symptoms are. I think it's always good to trust your instincts. If you are worried about one of your loved ones and you don't think that this is just a routine common cold that you've seen before, then just go take them to get evaluated. It's best to get another opinion on how they're doing. A lot of times families are always right when they bring in their loved one. It's almost always a much sicker cold or flu than usual. And finally, of course, wear your masks this winter. Masks still prevent a lot of transmission of these viruses that can cause these symptoms. So I do recommend wearing the mask, especially if you're on the train or in a busy store or around people in general, and then get vaccinated. This is the clinic that I work at, Settlement Health. Feel free to reach out to us to make an appointment if you're due for a primary care visit or if you want a new doctor in general. We do offer all these vaccines that we're going to talk about. We're based on 106th Street between 2nd and 3rd Avenue. We see children and adults, and we have physicians who speak English, Spanish, Arabic, and Hindi. Just a quick plug about long COVID. As you all may know, long COVID is a collection of symptoms. It can be up to 200 or more symptoms that happen after having a COVID infection. This concept of long COVID is still being studied, and there are a lot of long COVID clinics that are trying to help people through these symptoms after the initial infection. If you think you still have persistent symptoms after having COVID in the past, try to seek care at a long COVID clinic or reach out to one of the programs or community organizations supporting people who have long COVID. And then finally, these are the most important vaccines for this winter to prevent any of these respiratory distress symptoms. If you haven't gotten a new COVID booster, they did come out this fall, and those are designed specifically to the most recent COVID infection, the virus that's circulating right now. So definitely recommend a booster, as well as the 2024 flu vaccine every year. We recommend that as well. RSV is another virus that commonly spreads in the winter. If you haven't gotten your RSV vaccine, vaccine, then definitely get it. Everybody over the age of 60 should get one, especially if you have any high-risk conditions. We have the vaccine at our clinic. You can also try to make an appointment at one of the community pharmacies. And then finally, the pneumonia vaccine. This one is recommended in all adults over 65, and then any adult who's high risk, meaning if you have any chronic medical conditions like diabetes, cancer, heart disease, or HIV, then you should get the pneumonia vaccine as soon as you turn 19.